Treating bulimia nervosa. Biomedical treatments of bulimia nervosa. Because of the secretive nature of bulimia, it is estimated that most of those who suffer from it do not receive treatment, or only for depression. Goldstein et al. In 1995 found that Prozac reduced binge eating by 51%, compared to 17% in patients given a placebo. The US FDA has approved the use of Prozac for the treatment of BN based on such studies. Behavioral treatment of bulimia nervosa. An example of a behavioral treatment for BN would be breaking the binge/purge cycle. The aim of the therapy is to restore control of eating but avoid dieting. The patient typically has to investigate their behavior, figure out what triggers, recondition their behavior response to stimuli. Cognitive treatment of bulimia nervosa. CBT is the most widely used therapy for bulimia nervosa. The therapy addresses the cognitive aspects of BN: obsession with body weight, negative self-image, dichotomous all-or-nothing thinking, in combination with behavioral aspects such as binging and purging. Wilson 1996 found that CBT had greater effects on bulimia nervosa than medication alone. CBT plus medication worked better than CBT alone. 50% of CBT patients stop binging and purging. Psychodynamic treatment of bulimia nervosa.
According to Snyder, 1990, BN is a symptom of a developmental problem and expresses an unconscious conflict. For female bulimics, the issue lies in the development of an identity separate from the mother. A girl has to identify with her mother as a female, all while distancing herself from her to attain autonomy.
When this process is disturbed, individuals can develop BN. Binging is a regression to a state of oneness with the mother, primary feeding. Purging is the rejection of the mother and assertion of self. This is why BN is more common among women. A problem with this approach is that there is a risk the therapist will substitute a general schema to a patient's individual situation. Humanistic treatment of bulimia nervosa. A humanistic approach may therefore be more desirable. However, it also has limitations, as there is a risk of downplaying the severity of the patient's incapacities. A humanistic approach is probably the best during the maintenance final step of a stage-oriented approach. Group therapies for bulimia nervosa. The use of group therapy in the treatment of BN can be challenging, given the secretive nature of the disorder. There are also concerns with group therapy. The group setting may normalize abnormal eating behaviors. Patients may get negative ideas from each other.